Hello, everybody, and I would like to welcome you all to this session at Thrive Africa for the Mobile for Humanitarian Innovation team. My name is Jaki Mebur, and I'm the Market Engagement and Strategic Partnerships Manager for the GSMA Mobile for Humanitarian Innovation team. We specifically look at accelerating digital humanitarian assistance. Welcome to our session, and in this particular session, we shall be discussing digital protection in the design and delivery of humanitarian assistance. We have a great panel joining us today, and this particular topic is of great importance because, as we all know, adopting new technologies in humanitarian programming has, a myriad of advantages. There's, improvement in efficiency, improvement in speed, self-sufficiency. However, as we do this and also do this in partnership with our private sector partners, there is a need to consider the base humanitarian principle of do no harm and how that applies back into adopting technologies. On to our great panel of experts, and we shall have introductions from you. So if you please introduce yourself and tell us what you do, starting with Safia.
Hi, everybody. My name is Safia Verjee. I'm the Innovations Manager for the Kenya Red Cross. I work with regular programs and different departments within the organization, and we look at how we can use emerging tools and approaches to improve our overall service delivery of humanitarian aid.
Thank you. Over to you, Otto.
My name is Otto Farkas. I work for Nutrition International, and I'm based in Ottawa. Nutrition International is a global leader in finding and scaling solutions to malnutrition through low cost and high impact interventions. And we work in about 60 countries around the world, headquartered out of Ottawa, Canada. And I'm responsible for business development. However, in my previous roles, I have worked very extensively in the humanitarian sector.
Thank you. Over to you, Lilian.
My name is Lilian. I work for Safaricom PLC in the M-PESA team. So I take care of financial services for business customers. So we work a lot with anybody who's not a consumer. So I build products for anyone who's not a consumer. That is both our large enterprise to small and medium enterprises, but also I work a lot with some of our NGOs and humanitarian organizations.
Thank you. And so off to, our very first question, definition of terms. It is quite common that, the private sector and, the aid agencies would have differences in terms. And so let's try and get on the same page. Otto, what do you hear when the term digital protection is used, and how does that apply to humanitarian assistance?
To my knowledge, the term digital protection is not widely used in humanitarian circles just yet, but it definitely implies something that goes beyond the traditional domain of data protection or digital security that seems to come to mind when we talk about digital protection in general. And therefore, it's a very important concept to grapple with, even though it's still evolving in the minds of humanitarians. Maybe for the private sector, it means something totally different, but for us, it is still an evolving concept. And clearly, the role of digital media and innovative technologies is becoming central to protection-based work in the field in this time and age. And we have seen a lot of good investment going into data protection and privacy considerations and principles. The recent release of the second edition of ICRC's handbook on data protection for human action is a case in point. And so we also have seen a lot of good work going into what we're calling these days digital do no harm, which again takes the analysis of risks and threats to a whole new level, because it's looking at how beneficiaries of disaster affected people are interacting with social media or with technology, and the consequences of the weaponizing of information that are often a part of major conflicts. And again, this is an area where humanitarian actors are increasingly concerned about, but also we have very limited control over that space. And so we need to go beyond just looking at what we do with our technologies, and also looking at how the beneficiaries themselves interact with technology. So for instance, just think of a scenario, a conflict scenario where a humanitarian agency has to deliver cash assistance on a digital platform to internally displaced persons or IDPs that were just driven out of their homes through inter-ethnic or intercommunal violence, which was triggered in the first place by the use of fake news on social media. So again, that just kind of puts into perspective that protecting the data of the beneficiaries that we deliver services to, or protecting at-risk populations from the consequences of weaponized information, they're two different levels, and yet they're very closely connected. Back then, majority of the aid was delivered on paper-based processes, or analog paper-based processes. You see the example of thumbprinting on paper. That is kind of the ultimate expression of accountability in that time, and that was essentially used for billions of dollars of aid. And yet there are many issues with that, as we all know, and the digital solutions have eventually took over. And so we have seen the evolution of technology in the hands of aid workers. Significant changes. Back in 2008, BlackBerry was the smartphone. There was no cloud. There was no, open source infrastructure, and so on. So we essentially have seen a radical change over time, and a very short period of time, of available technologies. But it also meant that concepts around data protection, data security had to evolve, and the practices along with it, going from storing beneficiary information in a warehouse to the cloud, right? There's significant shifts. And at that time, you needed a pickup truck to steal the data or hack the beneficiary information, which nobody did because it was totally useless to keep data in these binders. But as soon as you could transfer those into digital format, it became both a risk and an opportunity. And that, of course, resulted in a significant evolution of thinking around how do we protect beneficiaries, what does it mean for us, and what technologies are appropriate, and it continues to evolve. And by 2013, we have already seen that technology became universal or becoming increasingly ubiquitous, and therefore it's considered a responsibility, not a choice. And so the whole idea about then how do we use technology responsibly, what's within our control, was also essentially guided by regulatory frameworks, and there are many good tools and many good processes out there that are now in place. They were not there when we started in 2008. And again, it continues to evolve. And so just to come back to the definition, in my understanding, digital protection is combining data protection and digital safety, as well as digital do no harm principles. And it's fundamentally concerned with key areas such as safeguarding the dignity and human rights of disaster-affected people, ensuring accountability to beneficiaries, as well as, I would say, to donors who put the resources in place, and also requires that we use data responsibly, but also the technology that's available. So we are mandated to use technology for the interest of safeguarding dignity and ensuring accountability. So the difference here is that digital protection is also going beyond data protection and digital security. It helps view affected populations as active participants with agency who also has direct access to technology. So that's kind of the new reality, the next frontier for agencies to combine what we can do with our systems, and we should be, and how we follow the best practice and regulatory and ethical guidelines, but also how is the technology, the social media landscape and the ongoing innovations in this space impacting beneficiaries themselves, who are directly in touch, directly experiencing the threats associated with some of the negative effects of penetration, the penetration of media and technology in their space.
Thank you, Otto. And there you have it. Digital protection is beyond data protection, beyond just digital security. It is seeing affected populations as active participants and critically with agency, with the right to say yes, to say no, to make decisions with direct access technology. Thank you very much for that, Otto. So looking to align terminologies, what do you, as someone in the private sector and a mobile operator, understand the term digital protection? Lilian.
So for us, digital protection, I think looking at the categories, where we squarely sit is mostly around the protection of the humanitarian life. So that's being able to take care of their information or data that we are privy to as we provide financial services to them. So their safety, inclusion, and also access to the products. Yeah, that's just at a very high level. However, when we go now into detail, it also has to, we also have to work a lot with the humanitarian to make sure that there's inclusion, that we're working with the communities, that any financial services we offer, we of course offer training to the communities, there's awareness, there's visibility of what we're trying to do. From an education perspective. And also, I think a lot of the times we often get involved also with the on-ground, I'd say, the organizations that support on ground, from government bodies to other humanitarians to security officers. So there's a lot of involvement that has to take place prior to access of the financial services. And we, a lot of the times, have to be involved in these initiatives.
We shall move on now to Safia, looking at all these, principles, doing no harm, looking at data protection, and looking at this in practice, with technology. So over to you, Safia.
Thank you, Jaki. I'd just like to give a brief introduction first to the organization. The Kenya Red Cross is the largest humanitarian organization in Kenya. So we have 47 branches based in all counties. And we have over 150,000 volunteers, many of them youth, and maybe many of them coming directly from the communities that we work with. We are what we proudly call a grassroots organization. We work with the most vulnerable in times of emergencies and also in times of disaster recovery. We are mandated to work as auxiliary to national and county governments. So this means that all the work that we do is tied into overall government strategies and objectives. So just to give an overview of some of the groups that we work with, disaster affected communities, mostly focused around the what we call the arid and semi-arid areas of the country, so towards the north and towards the east. But then again, you have populations that are also affected by flooding, so then that takes us to the highlands of the country. So in essence, where we work across the whole country in very hard to reach areas. We like to focus a lot of our programs, or we like to ensure that there's total inclusion in all of our programs. So women and girls are very much a central focus of what we do, and we rely on them as key informants and decision makers, and then as well as people living with disabilities and people also living with chronic diseases. Our main mandate is emergency response. Our motto is first in and last out, and this we're able to deliver on this given our wide and extensive reach within the country. We are also focus on long-term programming and resilience strengthening within the communities. So this involves programs focused around improving food security and livelihoods, economic empowerment, youth engagement, looking at creating long-lasting and sustainable access to clean water. We're also looking at how do we create access to health services, how do we create health-seeking behavior amongst our communities, and also how do we target all age groups, from young children all the way to the elderly, in terms of overall wellness. Innovation is a relatively new term to the Kenya Red Cross. I think we were officially formalized as a department only 2 years ago, and the idea is one, how do we use new approaches and technologies to improve our service delivery, but also how do we leverage on existing capabilities and capacities at the community level? How do we support them to co-design solutions to address their own challenges, become owners of their own solutions? And I've put here the data protection policy, which I know is the topic that we are addressing today and speaking about. And the Kenya Red Cross has realized that we need to take a leading role in this, given that we are now starting to use digital tools and technology in a lot of our programs. So as an organization, we do have a policy, and it's completed and just waiting for approval by our board. So today I wanted to share with you some examples of where we've used mobile and digital tools for disaster response and recovery. And I'm going to focus on cash transfer programming. So since 2011, we've used cash as a mode for disaster response. So instead of doing food and non-food items handouts, we found that actually providing cash relief to affected populations is giving them dignity and choice in what they want to invest in, whether it's education, whether it's food, whether it's economic stability. It's up to them what they want to prioritize. So we've come a long way in how we've been doing cash transfer. What started off as walking around and handing out 3,000 shillings, 3,000 shillings, 3,000 shillings, and then ticking a name off an Excel spreadsheet, we have now evolved to using M-PESA as a mode of cash transfer. So we've moved from something that was sort of very risky and exposed us to a variety of risks to something that's now a little bit more stable and accurate. Some of the challenges that we've been having with how we've been doing cash transfer, transparency and accountability. So beneficiary targeting becomes difficult when there's a lot of people affected. How do you know who's actually affected, or who maybe shows up to a registration and isn't even from the area? How do you track some of these beneficiaries to make sure that the cash has helped them, that it's been used for the right purposes, and also like how do we also make sure that different organizations are sort of working in a very cohesive way. There's also the issue of duplication and fraud, because as you can see there, it's all paper-based and manual. There were issues of people duplicating numbers, duplicating names, so people receiving more than they were supposed to receive, and some people not receiving anything. So there were some of those issues that we were faced. Again, manual process. In times of emergency, you really don't have time to sit and record every single beneficiary's name, where they come from, their phone number, their ID number. So we found that was also taking a lot of time, wasting a lot of time when you really just need to deliver life-saving aid. And then survey fatigue. So you'd have Kenya Red Cross, you'd have, for example, World Vision, Save the Children, all these different organizations registering the same beneficiaries. It gets tiring for them, and it gets tiring for organizations as well to keep doing this every single time that a community is affected. So we've thought long and hard about how we can address some of these challenges to make Kenya Red Cross more accountable and transparent to our beneficiaries as well as to our donors. So I think we're one of the first organizations in the region to adopt blockchain for cash transfer programming. There are many opportunities that we can use this platform. For example, just maintaining records that are not able to be tampered with. So this would make us as an organization more transparent and accountable. But then as I'll go into the next example, digital identities for targeting the most vulnerable populations. And then another use case for blockchain is cryptocurrencies and smart contracts, which we're also currently exploring. So we did a blockchain pilot in 2018. This was together with Norwegian Red Cross, IFRC, funded by Innovation Norway. It was a quick pilot. We had technology partners on board, Red Rose, Safaricom, M-PESA, and Craft Silicon, who came on board for this pilot. And the idea was to do cash transfer using the blockchain platform to be able to showcase the improvement that this technology brings, especially in regards to data protection, privacy, accuracy, in terms of cash transfer. So we did the pilot in Isiolo in May 2018, and we targeted 2,100 households, and each household got 3,000 shillings, which is about $30 in unrestricted cash. And this was really a good pilot for us to use blockchain as part of cash transfer, but also to show the benefits in terms of using a platform that doesn't allow tampering meant that beneficiary data was safe. Nobody was able to adjust any numbers or IDs or amounts being transferred, and everything was being recorded every single step of the way. So as an organization, we really believe that this is the way to go, because reporting back to our donors was really great, because they could see every single transaction, and reporting back to the beneficiaries or our customers was also really great, because they could see that everything was very equitable in the way and transparent in the way that it was done. And now moving on to a project that we're currently implementing, funded by GSMA, and we're doing it in partnership with the British Red Cross and 510 from the Netherlands Red Cross. And this is the one-to-one personal cash aid project. So one-to-one is a solution that has been developed by 510. And the idea is that it's a mobile-based application that allows a beneficiary to input their own data. So there's no beneficiary registration, so to speak. It's not manual. It's an application, and the beneficiary registers themselves. Of course, we'll for the pilot and in the beginning, we'll have Kenya Red Cross volunteers being able to support the registration. But the longer term vision is that a beneficiary or an affected person is able to input their own data. So already we're addressing the issue of data protection and privacy. And then so in the event now of a disaster, let's say a drought or a flood or any sort of disaster, aid workers are then able to very quickly verify populations affected, make sure that they're registered, and then aid can now be transferred directly to them in a very quick, safe, and efficient way. So this, I think, is the bigger picture, that we're talking about a disaster. People are affected. People don't have food. People don't have shelter. What's the quickest way to get aid to them? But making sure that they are safe, their data is safe, and there is no risk of anything being stolen or improperly handled. So that's the project that we're currently doing. So we're hoping from this pilot we'll be able to show the use case for using technology in a very safe way, but in a way that also gives beneficiaries, affected people, our customers, control over the data that they submit. There's no need for us to know as aid workers how much somebody earns or how many people are living in this household. It's really not necessary for us to be delivering aid. So this is the current pilot that we are doing. We're also working on another digital identity project as well, funded by Innovation Norway, and we're hoping that these two solutions will give us good use cases for using tech in a very safe way that prioritizes data protection and privacy, but at the same time ensures that aid reaches those affected in a very timely and effective manner.
Thank you very much, Safia. And if anyone has any questions on these, we can address them at the end. So now, looking at putting up technology into the field, and as Otto has already covered, what digital protection actually means. Otto, back to you. Are there any risks that are presented with the introduction of new technology amongst vulnerable populations, and then how do you mitigate them?
In terms of my experience with implementing technology, I could also use an example from my recent time. I was based in Ethiopia with World Vision, and we implemented massive humanitarian development programs, and so the IDP response in Ethiopia has become a major preoccupation for most development and humanitarian organizations over the last 2 to 3 years. So I can speak about that experience in general, but before that, I just want to again refer to my experience pioneering the last mile mobile solutions at an era when technology was not yet available, and the concepts around protection were not yet developed, and so again, I've got a really good appreciation of the challenges organizations face in adopting and taking technology up and scaling it out. And again, before it gets to the community, actually it begins with the organization that is going to deploy it, right? So if the organization doesn't have a good handle on the technology, then it's going to fail. So, but of course, as you bring it to the context of a humanitarian response and use technology to interact with communities, but also essentially deliver services. And so it's going beyond just let's collect data on a smartphone, but really how do you use mobile and digital to deliver services faster, better, cheaper, and so on, and better accountability. So that's really why any technology that is introduced into humanitarian context must be designed from essentially at the outset to uphold human dignity and human rights to begin with. So it needs to improve the experience of the beneficiaries, but also it needs to contribute to the accountability to beneficiaries and to the donors, which again, often digital systems moving away from paper-based systems demonstrated the value of both the data that we collect, but also the accountability for results and resources that are put to use, and also how we communicate with beneficiaries has been enhanced. And then also the technology ecosystem in a given context and the digital literacy of the affected population is a huge factor in adopting technology. And you have Safia mentioned examples from Kenya, which is one of the most advanced ecosystems in terms of mobile digital technologies that are used widely and often cited as the best example for adopting mobile money, mobile banking. And so it's not the case in every country, and it's very hard to replicate. So every country would have its own unique contextual issues that influence the adoption of what technology you can introduce and how far you can take it. And finally, of course, the regulatory environment in any context will be critical. So both the global regulatory environment, which is often coming through the donors that are funding the endeavors of projects, but also the local, which again at different stages. And so those are all need to be factored in. These are all variables to be factored in as you take a technology to the context of a humanitarian response. And so I just want to come back to the example from Ethiopia, where I don't know how familiar the audience is with the situation, but for the last 2 or 3 years, Ethiopia has been experiencing an upsurge of inter-ethnic, intercommunal violence, and that resulted in massive displacement of populations internally across regional or local district boundaries, and it created such a rapid and large-scale influx that caught everyone off guard. The government, the humanitarian NGOs, they were all not prepared to handle such a large scale and sudden influx of displaced people in a context where we usually have chronic, protracted emergencies like drought. So this was a real challenge. And it also exposed a lot of weaknesses in terms of how much technologies have been adopted in the context. And again, as I mentioned, it's a number of variables that prevented the Ethiopian context from taking advantage of the latest advancements of digital and mobile technologies in humanitarian response. And an example is the cash response, which essentially it's very minimal. It represents a very small portion of humanitarian response, and within that digital delivery of cash, like mobile money, it's even smaller. Let's say 1%, 2% of all cash deliveries for humanitarian response. So it's really a long way to go, and the adoption of technology has been very slow. And so this was the context where, when we established the CCD, or the collaborative cash delivery network in Ethiopia, the very aim was to improve cash programming, but also to modernize cash programming, because we were all doing everything on paper. As you see it on the left, most cash distributions were done on paper, despite of all the advancements over the last 10 years everywhere, and also very few, the infrastructure is not in place to deliver cash at scale, at least not in humanitarian context. It required us to introduce digital identity management, digital registration. Yet we were not allowed to register beneficiaries directly face-to-face. That's the responsibility of the government in the context of Ethiopia. So we had to administer aid at very large scale. Like, let's say we had food distribution projects in World Vision for 600,000 beneficiaries every month. And all we had is a paper list provided by the government that was full of inclusion, exclusion errors. And so it was really hard to verify actual numbers, and it was just a real difficult challenge. And that was further compounded by politicizing the whole returnee process, which essentially meant that people were asked to return home before actually they were prepared to return, and therefore there were issues around targeting and who is supposed to receive and who is not included. So there was a really delicate situation in which we tried to implement digital technology and to demonstrate the effectiveness and efficiency for the beneficiaries and for the organizations, but also to bring some order into chaos, which was essentially having better beneficiary management. Beneficiary distribution list, as well as better reporting and real-time reconciliation with inventories, whether it's food or cash. And so all the benefits that associated with digital technology were immediately introduced in a very short time frame, and we were able to get multiple agencies using the same platform that was essentially a much simpler platform than what's available these days around the world, because again, the context of Ethiopia did not allow us to leverage cloud or network or connectivity to the extent that real-time cloud-based application would be feasible. So we had to use offline, as well as roaming capabilities, and so it was all easily implemented, but the complications again were mostly associated with human processes, which is again, how do we make sure that the humanitarian space is there for us to put the technology in the hand of aid workers and also in the hand of beneficiaries. And that was not much to do with technology itself. Technology is available, robust, and flexible, but the processes that needed to be in place that required a lot of coordination, collaboration, advocacy among agencies, between the government and agencies. So I just want to point out it's the key is really not just about what technology you use, but how you deploy it and how prepared you are to deploy it, and that requires the alignment of all those factors, as I mentioned, the organization's readiness to adopt it, because we have seen organizations in the very same context who are using technology readily everywhere else except in Ethiopia, and because of the constraints they were not able to adopt it, but also the technology landscape, the limitations of the technology ecosystem, as well as, again, the digital literacy, the access to mobile phones and technology among the target population, and of course the regulatory environment and the politicization of targeting and aid, all were factored in. But nevertheless, we were able to come within 6 months. We were able to deploy and go from a fully paper-based system to a fully a digital system, again with a couple of workarounds, using hybrid systems of paper, importing from paper to digital, and then eventually updating beneficiary records on digital. So again, a number of considerations. How do you adapt it? But in terms of again, the key takeaway for me is that it's less about the human less about the technology, more about the human processes and the organizational processes and capabilities that impact the uptake of any technology. Yeah. So again, just to recap, the requirements happen at multiple levels to make it successful. First and foremost, it requires good collaboration and leadership. You need champions to make it happen, and you need people who are familiar with both the technology and the regulatory environment. And so we had to prepare staff. We had to put in place search capacity across agencies, which was another successful aspect of the deployment, is that it wasn't a single agency trying to do it, but we came together as the collaborative cash delivery network, and different agencies took on different roles and responsibilities. One agency looked after data collection and monitoring evaluation, others registration, beneficiary tracking, other distribution, interface with the financial service providers. So that was in itself a very interesting innovation of collaborating, but also creating search capacity in a space where you have very limited capacity. And so we had to kind of rely on each other, including each other's equipment. So by working together, we could share equipment, and we could also start raising the bar in terms of awareness and capacity around how do you implement data protection and digital security protocols, right? Because when you're in a paper-based environment, those are just nice fancy concepts and a lot of regulation with very little application. And so being able to internalize both the technology, which required us to share, but also being able to internalize the regulatory environment, and then finally also to envisage a change in the technology ecosystem, as we know Ethiopia is opening up to monopolizing or liberalizing the telecom space. And so a lot of things are happening, and so we had to prepare and future-proof our platform in a way that will be able to leverage and harness these opportunities. And this is actually where GSMA came in and supported us in Ethiopia by actually helping us to understand how do we how is the technology landscape evolving that will enable digital both delivery of aid, but also mobile services to disaster affected people. And so that's essentially a work in progress. But again, keep in mind that it does require a contextualization at a number of levels in any given context. So it's really hard to tell, beyond specific examples.
Thank you very much. And now bringing it back to now addressing special vulnerable populations, Safia. Technology doesn't cover everybody 100%, and there will always be some special needs groups that need to be adjusted for, looking at the aged, minors, persons with disability, people with low literacy levels. So how do you adjust delivery of technology to ensure that nobody's left behind?
Great question. And I think I'll be talking from a point of from a theoretical point of view, because we haven't really had much experience in these pilots yet. But I'm hoping that with the piloting of the one-to-one, we're going to actually learn a lot about this. We're already learning as we're doing some of our user tests right now, dealing with connectivity issues. I mean, that's also a vulnerable group, like people living outside of good connectivity, meaning that they can't access information and then aid, or they can't use this sort of technology for humanitarian aid. I think it boils down to products design and development, and making sure that that these solutions are actually designed with vulnerable populations. So, for example, with the elderly, maybe the solution isn't using a smartphone or an app, but maybe the solution is using a very basic phone where it's SMS based and something that they are able to quickly learn. Also, people with disabilities, can we have solutions that are compatible for people with hearing impairments, or can we have something that supports people with sight challenges, So I think all of that comes at the design stage, and making sure that these voices are heard at that stage. So what we're doing right now is we're making sure that we have volunteers that will help the community every step of the way, so that there is no group that is left behind. So here, technology is an enabler, yes, but you can't remove that human element. It has to be there. So yeah, tying it back to the overall conversation, I think I'd say that. But one vulnerable group that I think we're also targeting is the population that isn't legally recognized by the government, and those are people without national IDs for whatever reasons, them being immigrants into the country, refugees, or just people who didn't have the right documentation and now can't seem to get recognized. How can we advocate and develop policies and regulations that support people without national IDs during emergencies? At that point in time, it's not whether you're Kenyan or not, it's just that you're affected. So taking into account risks and concerns at that level, how can we just make sure that we are reaching people that are also not legally recognized? So I think, Jaki, to answer your question, I think as an organization, we will start to, as we develop these solutions, we will start to include these groups at the beginning and at the design stage, but making sure that that we have the human element and we have the volunteers to help them every single step of the way.
Right, thank you very much. Just trying to understand, the protection environment that you work in. What regulatory factors do you consider when you deliver, solutions for somebody in a humanitarian context or a development context, Lilian?
From a regulation perspective, I think we usually have already predetermined sort of know your customer documentation that's already guided by our regulator. So we already know for someone to access financial services, this is the kind of documentation that they need. However, sometimes because of the nature of the humanitarian world, a lot of the people, the beneficiaries, might not have access to some of this documentation. So the role we have to play is ensuring that we are not failing to know who they are, but also not denying them services because they don't have specific documentation. So I know we've had engagements with the regulator to tell them, the beneficiaries might not have identity cards, but they have this documentation. It could be in the form of manifest, it could be in the form of just basic identification of either refugees or vulnerable people, children, such like beneficiaries. So we're able to tell them and give them the confidence that this is how they're going to access the financial services, and we'll be able to identify them in this manner. So it's been a challenge in the past, but I believe over time we've come also to an understanding that not everybody will have the documentation, but this is how we've been engaging the regulators in terms of and helping them understand that this is the kind of documentation that they have, so that they can allow us to offer the financial services. And of course, having to work very closely with the organizations or the bodies providing the services, because sometimes I know, for example, they might have their own identity or identification of the beneficiaries. So you might find a good example is like Red Cross sometimes might be able to identify the beneficiaries differently. So it's never a direct answer, but at least for us, what we're keen on is the identification document recognized by a government body. If yes, then it becomes easier for us to start engaging the regulator.
So last question for everybody. In one sentence, what is your biggest tip for stakeholders engaged in this sector to ensure that the design and implementation of digital initiatives are responsible and hold true to doing no harm?
Treat your beneficiaries as your customers and afford them the same protection, the same quality of service that you would for any paying customer. And I think that will change the paradigm.
Absolutely. Thank you, Safia.
We're all working for the same cause with the same objective. So how do we work together as a humanitarian sector to deliver these solutions and make sure that our beneficiaries and our customers are safe? So learning from each other, making solutions open source, low cost, effective is also super important. And I'd just say that that's my advice to all of us working in this space.
Lilian.
I think for me, the regulator, co-creation with the agencies and looking at the beneficiaries as a consumer with a lens from a design thinking approach, I think are the three key things we've learned in the past to ensuring that we deliver good products to them, but also while doing that, complying to the do not harm principles. Because while you do all that, I think someone would highlight what it means for us. It's a new concept for us. Sometimes we have to really be cautious of it as we develop products and services for them.
Thank you, Lilian. And as you can see, between Otto and Safia and Lilian, the rallying call around this is number one: treat all beneficiaries like paying consumers. This way, when you design for them, you take that into consideration. Number two, consider vulnerabilities. If it's disability, if it's gender, if it's their age, if it's IDs and things like that. And finally, this doesn't work if we don't co-create. And I think this is a really great message from the three of you. And thank you so much for joining us today. And we shall have a live question and answer session after this. And thank you very much. Okay, a bit of a scene change for everybody. Thank you, everybody that has joined us. And now we shall go into the live Q&A. And I can see we already have a question. This one is for Safia. From Susanna, what have been the key learnings from the pilot in 2018? I think this is the blockchain one. And do you see the use of this technology becoming a staple for future humanitarian delivery more widely?
Thanks for that question. I think our key learnings would be based on some of the challenges that I explained during the presentation. So what I think what would be our biggest achievement was realizing that we didn't have issues of fraud as we had experienced before during the manual process, and then using basic applications like Excel to record beneficiary information. So using the blockchain platform, we found that we didn't have that issue. But still, it was a very controlled pilot that we did, and I think that there's more opportunity to scale up to do it in our regular cash transfer programs, but also to look for more cost-effective platforms that we can use and that we can have control over. Thank you.
And thank you, Safia. This one would be for Otto. Bringing us to the issue of the day, which would be COVID-19. So there's a trend right now to do a lot of technology solutions to address emerging challenges brought up by COVID-19. So as a humanitarian, what additional vulnerabilities are you seeing that have been introduced by COVID-19, and then what considerations should be made as we bring in technology solutions and mobile solutions to meet them?
Thank you. Yes. We found that COVID is actually was an unexpected ally in terms of accelerating, trends in adopting digital tools and technology. So there's a plus side, or we try to look at it through the positive, that this actually helped us move much faster into the space that we were planning to move or intended. So there's that. Hopefully residual benefit that we will all adopt an accelerated adoption of useful technologies. But what I also see it's happening right now is that because we have to do it so fast, and if the organization hasn't done all the preparation in terms of how do you roll out, how do you adopt mobile tools on the go, on the fly, to continue doing your work, and without crossing all the T's and dotting all the I's of data protection, privacy considerations and whatnot, I think there's a huge risk of we going too fast, and different agencies maybe at different stages. If they're well prepared and if they align their digital strategies already, then it's a great thing. For others, this could be a real risk of suddenly we create and accumulate data that we haven't even thought through of how we're going to store and protect. And so I think there's some new exposures, and it's what we'll see is that there'll be more agencies moving into this space. And as I mentioned earlier, if you're not prepared to do it, you shouldn't be using digital, because digital, if anything, can exacerbate some of the risk, especially as we look beyond the interface between what we do as agencies with the data protection and digital security, as well as how the beneficiaries of the impacted populations, in this case by COVID, are interacting with this. And then add to that some of the new innovations in terms of tracing, contact tracing, and our considerations for privacy may be loosened because we are all under under pandemic. And so there's that, I believe there's a bit of a risk of not having enough time to prepare our digital strategies and align them across various aspects of our organizations. It's not just the people on the front line; it's also the comms people, the data security, all the pieces need to be working together. And I'm afraid there's just not enough space and time for that at this moment.
All right, so not having enough time is really something to consider. So this one is for Safia, and as Otto has pointed out, because of this sudden crisis, we're collecting a lot of data. And looking at the two examples you gave with blockchain and one-to-one, there is a significant amount of beneficiary data that is going to be collected. So how do you ensure the long-term protection of that very identifiable information that the Kenya Red Cross will be collecting on these platforms?
Thanks, Jaki. I think there are several efforts that we have already put in place. One is the development of an internal data protection policy that will guide the organization in terms of the data that we're collecting and how it should be collected and how it should be stored in a very secure way. So as an organization, we're putting systems and checklists in place to make sure that the data that we are collecting is protected. But what we're thinking through now is around what kind of data do we actually need for each kind of response or each kind of project, making sure that we're not collecting data that is unnecessary. I think from where we're coming from is the whole perspective of let's collect as much as we can because you never know when you might need it or what it could inform. But actually, we don't really need to know a lot of the stuff that we collect. So I think making a conscious effort to collect as little as possible, but then looking more long term, how can that process of beneficiary registration and data, that whole aspect of self-sovereign identity, where beneficiaries are in control of the data that they submit. So that data is never collected or stored by Kenya Red Cross or any aid organization. I think that's what the future is looking like for us.
All right, thank you, Safia. And this is for both of you, Otto and Safia. So as we roll out solutions like one-to-one, there is always that balance between delivering a humanitarian relevant solution and also the sustainability of it. And many times you're working with private sector providers to do this. So how do we find that balance and the understanding that as we get solutions and we put in the protection considerations that they must also be sustainable? Otherwise, you will provide a solution for a year, 2 years, and then it is not there anymore. And that, I think, also puts our beneficiaries at further risk. So Otto, what do you have to say about this?
So, yeah. as you concluded earlier, that the co-creation is a key key to success, right? And that takes time and preparation. It's not like something you do on the fly. You need to actually strategically partner for these things, and not just go for a project, but go. I would say we need to talk to each other before we actually arrive to a solution. We need to start with the problem, right? So again, defining a problem using the design, human-centered design approach, and I think both private sector and the non-profit sector are speaking more or less the same language. We're using the same toolbox. So there's a lot of good tools and proven best practices out there. So again, how do we take time to actually create and co-curate the solutions, right? It's curating is, to me, the key concept of how do we make sure that we find the right solutions for the problem, and not just support solutions looking for a problem, right? So again, how do we start with the problem and keep the problem in mind, and then reframe that problem into a solution? And again, I think that there's some really good experiences in that space. It's just that you need to do it not under the gun, not in when it's urgent. But there can be some, these techniques can be used very, the techniques from the IT sector have penetrated obviously the social sector, and the rapid prototyping and all those we need to embrace as NGOs as well. So I would say that's the closest I could come to an answer.
Right, thank you, Safia. Anything to add on that?
No, I completely agree with Otto from the perspective of human-centered design, but also, making sure that the end users are part and parcel of the design and piloting of the solution. Understanding and appreciating that different areas, especially rural areas, have a different context than urban areas, for example. So solutions need to be agile enough or flexible enough to be changed or iterated based on the context of implementation. So even if we're doing partnerships or there's donor funding for it, make it sort of flexible and long enough for several design processes or iterative processes for us to get like a workable solution for any context.
All right, thank you both. I can see we do not have any other questions. And so I'd really like to thank you both for taking the time to take this session. And while we're at it, I would like to take this opportunity to acknowledge that this program is supported by the FCDO and also the GSMA and its members, and to thank everybody for dialing in, and have a nice day. Goodbye.
Thank you.
Thank you.